Two people come together, one man, one woman, bringing to Mother Earth through a special method that's worth all the pain of childbirth. They're happy for the beautiful bundle of joy that could be a mama's boy or daddy's girl, who is his princess that twirls, or her handsome prince that makes her new world whirl. With excitement, till the unforeseen traits now condemns their new fates. Fates which look bright, now go on a long journey's fight. If you don't get what I mean, then just listen to our screams. Not only to our parents, but to everyone. Do you hear my, our, their cries? Still don't get it? Well, listen to this. Now a 5-year-old child, you used to see us smile all the time. Now taken over by our first painful crisis. Trust, it doesn't entice us to be stuck in a lonely room of a huge hospital. Our timid bodies are so little as our insides holler out for some relief. You really can't help our grief, although you try, cause you know, if our spirit is broken, we'll remain unspoken in the eyes of ourselves when we go deep into a sadness, cause no one can really understand the degree of its badness. Having to learn how to walk again, one step at a time. Like a toddler that strains to learn his balance, but will again attain not so much a level of strain. Veins, 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 as that level of pain is within those aforementioned veins that travel throughout our bodies, all our bodies, as we are united by this blood disease with crescent moon-shaped blood cells. Oh, please, don't give me that look. We have tried to attain funding, and many even wrote books to get awareness for this crook that seizes the blood and oxygen from getting to our tissue and organs. See, I don't find this boring, because it's our lives that we are sometimes mourning, because it continues to go on and on and on. Trust me, I don't think your conclusions have been drawn on what I am exactly talking about. So listen to this. Becoming a teenager should be some of the best times of your life. Don't tell me that's not agreed upon. What I'm talking about is not a phenomenon. You can already tell I'm talking about pain again. That monster bears down upon, as the doctors tell you, you can't rely upon your thoughts to be active and play sports, because if you decide to pursue those thoughts in your head and desires of your heart, thereupon, whereupon, you come upon, not counting upon, the acute and chronic episodes that will now be bestowed upon us. Those episodes can call for narcotics that make us like robotics, slowing down our functions like we're going through a malfunction. Never ask for this anemia, like you could say with leukemia. Yet cancer gets all the answers, and we get the minimal. Just want the same additionals, it's only a principle. Not all of us have anemia, but we all are anemic though. So maybe you should take the chance to learn and know about the disease I'm trying to explain. Still struggling to see where I am coming from? Just wait a little longer, because my emotions are getting stronger. Moving onto our final stage. Adulthood is like a turning of a page. As a child, we are taught not to judge a book by its cover. We go to the emergency department to seek help in our acute recovery. The recovery is hindered by the inadequate knowledge of the doctors that are supposed to help us. Instead, some judge as they are misinformed about our illness thinking that we are just drug addicts, placing those unfair stigmas on a large population of many people, causing stress in the forms of worry, tears, depression, and isolation, just to name a few, which is a cycle that brings more pain that we were trying to lessen. Isn't that true? Predominantly a black illness. Listen closely. It isn't just for blacks. Do you not hear the word predominantly? Meaning mainly or for the most part. Maybe you should hear it from the start. Yes, I said predominantly a black illness. But don't be fooled by the word predominantly, because this illness affects those of Mediterranean areas and other nationalities. Although maybe rarer, it's still a terror. Look it up if you don't believe me. Other websites and books will also agree. Only will scare you when it's someone closest to you too. Sitting in a cold waiting room, seeing that fearful gloom all over your loved one's face. Not receiving what should have been known as grace. We're all supposed to be adults, but the results tend to be an insult. Still in that cold waiting room for 7 hours, with more people to still go before it's ours. It doesn't empower, but turns our mood sour, and our hope for help devours. Having to go through this tough ordeal, not only from the beginning of our lives, but for the rest of our lives. Making a lot of us arrive at a negative outlook that derives from a known fact that outlives most of the patients it's referring to. The new age range of life are the mid-40s. All the complications, like blood transfusions, damage to organs, and more, just add to what we endure. That's pretty scary. So wouldn't you hate this illness too? To be afraid to die at a younger age? I hope what I said has gotten to you. Now. At the end of this story, I hope it was a little revelatory. I pray now you understand and take a stand to find out more and bring awareness to this illness called sickle cell disease.
I have to say that video always touches me. I've had it for a number of years, and it just came across it quite recently, and I thought I'd share it with the family on this afternoon. Right, so let's get started. It's 1 o'clock, the third Saturday of the month. I'd like to welcome you to Open House. Welcome everybody, great to see you here. My name is Samantha Greaves, and I am the group coordinator for Sickle Cell Cause. Today we have 2 sets of speakers. We have 2 that are guest speakers from the, written it down, from the NHS Improving Access to Psychological Therapies group, and they cover the areas of Barnet, Enfield, Haringey, and surrounding areas. And we also have an in-house speaker, our very own welfare manager, Leanne Palmer, speaking about the benefits of Kemetic Yoga. So in order to save time, I'm not going to linger on today. I'm just going to go through the presentation, then introduce our guests. So moving on. And hide my camera. Right, so as I said many times, we have to go through our housekeeping, you know. So before we begin, I'd just like to remind everybody that we are a grassroots peer-to-peer community sickle cell support network, and we believe in free speech, obviously without obscenities, you know, or personal judgments. And we highly encourage the voice of the sickle cell affected, whether you be a sickle cell warrior, a caregiver, sibling, supporter, etc. Everybody's voice is welcome and encouraged. Our official group ambassador since conception is Miss Judith Jacob. She is, most people know, a screen and stage actress, a radio presenter, a DJ. She's even a fitness instructor. and she's very popular in all of the fields that she occupies. So she is our group ambassador, and our honorary ambassadors are Mrs. Marvelyn Clare and Miss Donna Douglas, who are the wife and daughter of Dr. Neville Roy Clare, the late sickle cell warrior and ambassador. And he was a personal friend and mentor to myself, and he's the one that advised me to set up this group. He was the founder of OSCAR, the first sickle cell organization in Europe and the UK. And what I'd like to do, and OSCAR was founded in 1975, although he had done many, years of research prior to that. So I'd just like to recognize that everybody's efforts are truly appreciated and will always be remembered in sickle cell cause. Moving on, as I said, we are a grassroots organization, and sickle cell cause are managed and operated by the sickle cell affected volunteers, and our supporters, and we are not paid, we're not government run, nor are we government supported. We are real community members assisting our community and supported by our community. So the question is, what can you, our community, do to support your sickle cell organization as from now? Well, the first thing we always ask for is, if you're willing to take blood, please donate blood. On the left, you can see a picture of Tokwasi Holmes. She's from the National Blood and Transplant Donation Centre. You can give her a call on 0300 123 2323. Also get tested to see if you carry the sickle cell gene, especially if you intend on starting a family. And even if you're in later life and you're feeling pains that you don't recognize that, it may be, you may have the trait, and you may, you may even have the full blown, but have it mild. So get a test to find out if you carry the sickle cell gene, to see what can, if anything can happen to support you. Sorry, my voice is going. Also, we're constant need of volunteers. Most of our volunteers are sickle cell affected, and during these times, especially these times, many of us are not able to volunteer the hours that we would like to. So we do look in our community for that form of support. You can email us at sicklecellcause@gmail.com. Whether you want support for yourself, if you want to volunteer to our organization, and please donate to help our cause. We don't only help our sickle cell affected in the UK, but also in the Gambia, in Africa, and especially on the ground in the Gambia. We have many sickle cell warriors actually in hospital at the current moment that we're supporting. So any form of help, nothing is too small, and everything is greatly appreciated. Barclays Bank, sort code 204657, and PayPal, our email for PayPal is hasif, HASIF04 @yahoo.co.uk. Right, moving on, person of the week, of the month, Miss Brenda Smith. Now, Miss Brenda Smith is a supporter of the sickle cell community, and she's a powerhouse, and she is on a quest, right? And her quest basically is to recruit or to encourage 40 people from the Black, Asian, mixed race community to donate blood. Right, now many people may think that donating blood is very challenging and they don't look in to see what it involves, and maybe that's the reason why they, haven't done it as yet, or, haven't looked into it. But I just want to share a short video with you that will explain the process of what happens on the day when giving blood.
Making an appointment is the best way to arrange your donation, as it's easier and will save you time. Before you give blood, you should eat regular meals, drink plenty of fluids, and avoid any vigorous exercise. We aim to ensure that your whole donation journey lasts no more than 1 hour from your planned arrival time. When you arrive, you should give your completed donor health check questionnaire to the receptionist. You'll be given our welcome leaflet to read, as well as 500 millilitres of water to drink, which will aid your well-being during and after your donation. When your name is called, you'll be taken for your private health screening. You'll be asked some confidential questions, and your hemoglobin levels will be tested. This only takes a moment and is done by taking a small blood sample from your finger. If all is well, after a short wait, you'll be invited to a donation chair. A cuff will be put on your upper arm to maintain a small amount of pressure during your donation, and your arm will be cleaned before the needle is inserted. Your donation will normally take around 5 to 10 minutes to complete. Once you reach the full 470 milliliter donation, the needle will be removed and a sterile dressing will be secured on your arm. We'll also give you a card with some important care advice to take home with you. You'll then be able to go and enjoy the refreshment area, where drinks and snacks are available. You should relax here for at least 15 minutes and have at least 2 drinks to stay properly hydrated. After that, you can book your next donation appointment to keep saving lives with your generosity. Book your appointment to donate. Visit blood.co.uk today. Save a life. Give blood.
It does take a lot to give. It does take a lot, but it is a simple process, so please, all I have to say is for this month, I just want to recognize Miss Brenda Smith, right? She is an avid community action woman. She's a fundraiser, and she is also a frequent blood donor. She is on a quest, as I said before, to find 40 people of African and mixed race heritage to join her to raise awareness and save lives, just like she does, by giving blood. So you see, many people thought it was a daunting prospect, but it is really, not. Now that is, you can see her link there. So if you would like to join her on her quest, please, jot down that link that you can see on the screen. And she's always willing to help. I'm not sure if she's on the meeting right now, but if she is, I'm sure she will speak, a little later on. But I'd just like to take this opportunity to ask you all to help me, and to help us in the chat box by raising up Miss Brenda Smith, because on Monday gone was her birthday, and I'd like you to help us to join people like Sister Angela that just spoke, from the AGA Global Ambassadors, and other members of our wider community with saying thank you to Miss Brenda Smith, and saying happy birthday. We appreciate you. We appreciate all that you do, and we will do our very best to encourage people to join your quest to find Black blood donors to support the cause. Thank you. All right, I'm just leaving that up a little bit just so that you've got an opportunity to jot down the link. I will put it in the chat box when I get a moment also. Okay, so thank you, Miss B. If you're on the line, please make yourself known. If not, thank you so much. Okay, so right, moving on. Today is the 20th, I forgot the date. It's the 20th of February, and this is our second open house meeting for 2021, and it's time for us to welcome our first guest speakers. Right, so our guest speakers are from, let me see now, the IAPT, as I mentioned before, which is encouraging. Hello?
Hi.
Is that Miss B?
Oh, no, sorry, it's Rachel from IAPT, from IAPT.
Okay. Right, so we have Kenneth Ash and Rachel Brown, and also somebody else from the IAPT. I didn't catch your name.
No, it's just
Sorry, I said, yeah, it's Rachel and Ken.
Okay, brilliant. So if you would like to take it away with what it is that you have to share with us, improving access to psychological therapies with the NHS, we're all ears.
okay. Well, I just first of all just like to say thank you for having us both here and giving us the opportunity to speak to you guys. Really, because IAPT is a service which, as its name implies, improving access to psychological therapies. We really want to get the word out there about who we are and what we do, so that everyone can really kind of benefit. So as we mentioned, just a brief introduction, my name's Ken Ash. I'm one of the cognitive behavioural therapists, talking therapists at the service, at the IAPT service. I'm from the Haringey branch, but as Samantha mentioned, it covers Barnet, Enfield and Haringey. I've been in the role for about 5-6 years now, but I've been working in mental health for about the last 15. I guess just kind of thinking about also my other dual roles within my service. One of my roles is also as the BAME lead within my service, and I actually kind of do a similar role across the trust as a whole. Okay, I'm up the steering committee, don't do the whole thing for the trust. So that's kind of who I am, and it's in that context that I come to you kind of thinking about kind of what we might be able to do, okay, that might be helpful. So before I go on, I just wanted to check with people, maybe has anybody here even heard of this IAPT service, or perhaps even used it? Does anybody know anything about us and what we do?
Yes.
Hi Jason.
Yeah.
What do you know about our service? What have you heard, or what's your experience of us?
Well, I work for NHS Trust in Coventry myself, and they have an IAPT service, and I've used the service in the past as a member of staff. It's COPE. They've got like a service called COPE, and I've used that for staff. It's for staff who needed like support. So I've used that. I'm aware that they do with patients in the community as well. That's what I know.
Okay, that's a nice place to start. So again, as it sounds like as a staff member, you've had some dealings back in Coventry, if I understand you correctly, and you were provided with some support, but you're also aware that it's not just kind of a workplace thing, it kind of goes out into the community, that it's supposed to be for everyone.
Yeah.
And that kind of brings us to what IAPT is supposed to be about, because the whole, IAPT, I keep using this word IAPT instead of Improving Access to Psychological Therapies. It's just a bit easier to say and quickly, but so we call ourselves IAPT. This IAPT service has been around since about 2008, and its general idea, sorry, excuse me, that's much better, isn't it? The general idea is that we found that psychological therapies as a whole were actually quite difficult or expensive for people to access. So people didn't even know they existed or were there for them, or the people who did know they were there were people who could afford to pay for it. And because of that, it made it really exclusive. Only a few people who could benefit or needed the support were actually getting the benefit and support from these services. So what we really wanted to do, what the kind of way it was set up, was to kind of see if we could improve it. So if there's more people who are struggling with these things and having problems with just really common mental health issues and difficulties, which I'll talk about shortly, then it would be helpful if we could make it accessible to more people if they wanted to access it. And that's the general idea behind the service. I'm just trying to think of anything else. So as I said, it excluded many people from those potential benefits. And what it also does in an IAPT service, we've kind of identified the fact that for certain types of really common problems, and when I say common problems, I mean things like difficulties with, it can be things like difficulties with your sleeping patterns, just general levels of concentration, irritability, worry, anxiety, stress, low mood, physical health problems is a major thing that the services has been dealing with, and the way it affects our thinking and the way that we function. These really things that a lot of people do struggle with, and IAPT is there to support people and give people a space to go where they can help, hopefully, to improve some of those things. And to do that, we offer a set of types of interventions or therapies, or just support, which is what we call NICE approved. NICE is an outside of the NHS organisation which says, look, this is the right type of treatment. If you've got this type of difficulty, then this will be the type of treatment we recommend out of all the treatments that is best to help you with that type of difficulty. And we try and provide those in our service, okay, to a limited extent. What we do is we do a couple of the key ones, and the ones that we don't do, we kind of signpost and direct people towards. So, I mean, that's a little bit about IAPT and who we are and what we do. We're here to serve our community, Okay, and I suppose the message is we're here to serve our community, and we're here to serve all of the community, not just parts of it. Any questions about that so far, or anything anyone wants to ask me at all?
We have a lot of people like regarding like bereavement counselling, because a lot of people are bereft at this present time.
Okay.
And how deep do you go, and do you go?
Okay, that's a good question. So I was thinking, I'm going to answer that question now. I'm going to do a Q&A and then, so if anybody else has got any questions, you're more than welcome to kind of ask any questions at any time and at any point. In answer to your question, bereavement is something that we can work with and deal with, but I guess just to let you know that there are actually, this is part of the things, people can come to our service with bereavement, and we might say to them, look, you've got an option, you might want to work with us, because we can do that. We can work with you and help you and support you through a time of grief, through offering some counselling to address your bereavement. But we might also say to them, also to be aware there are specialist services which deal with counselling for bereavement, and you might want to go there instead. We'll always give people a choice. If you want to go to a specialist, you can. If you can come to work with us here, you might want to do that as well for whatever reason. But we can certainly work with that, absolutely. Yeah, and we do a lot of work.
Do you signpost people to these other services?
Absolutely. That's one of the functions of the IAPT service. Often what happens is, you know, you mentioned we're an NHS service, but we're what we call a primary care service. So we're kind of on the same level as your GP surgery, kind of a first port of call. So your GP, often people go to their GP, then get referred maybe to ourselves, and then once they get referred to ourselves, we kind of act like a bit of a gateway sometimes, because it may be that the core services that we have within our service may not be right for what the person is experiencing, in which case we need to, well, our goal is always to make sure the person gets the treatment, the best and most appropriate treatment for whatever it is they're going through. If that's something we can help with, by all means, we will deliver that to them. But if it isn't, we will, as you say, signpost and direct them to the right type of service to get the right kind of treatment for whatever it is that they're going through at that point.
Okay.
So,
I don't know if anybody else wants to ask Kenneth any questions.
Yeah, can I ask a question? Is there a waiting list for your service?
Okay. So yes, there is a bit of a waiting list for, well, thinking about depends on what it is for, really. Different things, there's different waiting lists for, because I'm just kind of thinking maybe it might be a good time to think about maybe what it is we do. But before we do what we do and what we might offer, because there's a number of things we offer, and for the different things we offer, there might be different waiting lists. Okay, so just before I go and chat, I just wondered whether you wanted to say anything, Rachel. It gets boring of hearing my voice.
Sorry, I'm on the camera because I have a kitten, so sometimes my kitten tries to climb across the laptop. So yes, that's a good summary and introduction. So I'll just introduce myself. My name is Rachel Brown. I'm a psychological therapist working within IAPT. So I actually am a long-term conditions therapist mostly, so I mostly treat people with long-term health conditions. But the other side of my role is that I'm also the community engagement and outreach lead. Well, I was until Friday, so I am actually changing roles, and this will be passed on to someone else, but I still really wanted to meet with you guys today. And really just wanted to mention about kind of why we do these kind of things, why we do these groups, and come to reach out to the community. And what we're really trying to do is improve the access, improve access into our service. And this isn't just how many people are accessing our service, but also we want to be working towards representing our community, representing the population of Haringey. And in order to do that, we are looking to reach out to minority groups who might not maybe ordinarily access our service, as figures have shown, and perhaps maybe there is some understanding on our side about actually what are these groups looking for, what are you hoping to gain from the service, and trying to understand that better. So we're really working to partner with community groups, not only to raise awareness about our service and tell them about what we do and how they can access support, but also actually to improve how we deliver services, and actually so we're catering to people's needs and actually offering what people are looking for. So it's kind of both sides really. It benefits us in our understanding of kind of what the community is looking for, and listening to people in the community, and that collaborative approach, and also kind of us delivering that awareness and understanding, and part of that is delivering things like stress and anxiety workshops. So I've been delivering a number of workshops in the community that look to give people practical skills and techniques to manage symptoms of stress and anxiety during the pandemic, because we've all gone through change during this time, and no matter kind of for everyone it will look different, but just giving people some skills to maybe think about how do they manage that worry that they're having, or maybe that their routine as things have changed and the environment has changed. So yeah, that's just a bit of what I do, and in terms of kind of community work and outreach work.
Okay.
Okay,
thank you. Yeah, that's great. So thank you, Rachel, for that. So just to again, any questions on anything that Rachel had to say, or any comments?
Okay, I'll just look in the chat box to see. I'll start from the last one going up. Does this service work in other boroughs too, like Hammersmith and Fulham?
Absolutely. So not only does it work in other boroughs across London, which you should find it in every single borough across London, but it's in nearly every other locality up and down the UK as well, barring a very few places. I think there's some places in maybe Scotland and maybe a couple of other areas. In general, you'll find it nearly, as one of your group mentioned, Jason, that in Coventry there was an IAPT service. So really, it's up and down the country.
Yeah, and I'm just to add to that, I'm just trying to put it into the group, but I'm going to just put in the chat, there's something called the IAPT Finder. So that's actually quite helpful. It tells you about the different IAPT services in different across the country. So you can, I think you can click on that, it should go to the right place. And you can put in your postcode, and then it tells you what the nearest IAPT service is to your area. So yeah.
Okay. Any other questions from the chat box?
No more questions. I've got people wishing Miss B, our superstar, a happy birthday, belated birthday. But no other questions. Does anybody want to ask a question openly?
Yeah, can I?
No,
sorry, no. The link that you just put up is not found. I just clicked onto it and it says the page not found on it.
Okay, let me try that again. Sometimes it's because I've copied it too early. Okay,
thank you. Sorry, I know I joined a bit late and you might have covered this already. How do you access your services?
Okay. So with contact, so in terms of access to service, so there's a number of different kind of pathways or routes into the service. But I suppose this is part of changing that. I mean, traditionally, what's happened is, people have gone to their GP saying, I'm not feeling well. I may be having some sort of one of the kind of typical complaints I mentioned earlier, which the GP might recognise as things that IAPT deals with, things primarily around feelings of anxiety or lower mood, and then the person's GP will make a referral to our service. That's how it normally happens. Or we also use quite a lot is direct individual referral. So that is, if you know that IAPT exists and you know what it's for, you can contact us directly, cutting out your GP, and just say, look, I think I'm struggling with my sleep, or I'm feeling quite stressed or worried, or whatever it might be, and I would like to talk to your service, and that will begin there's an online referral. So maybe what I'll do is if you could, Rachel, could you do a link to the referral page if you haven't already?
Yeah, put a link to the website, and if you go onto the website, it has information about our service, and at the top tab it says, sorry, on the right hand side it says refer to Let's Talk. Okay. So it's a really simple form you fill in. But, yeah.
But those are the main two, but that's by no means the only referral pathways. You know, we can be done through social services, could be done through the hospital, it could be done through your physio, it could be done with any kind of allied, you know, or any organisations we work with. You know, it can be done quite easy, and when, as Rachel mentioned, doing some sort of collaborations and making some connections with the community will make just other pathways through which, you know, people can be aware of our service, what we do, and how we might help, and can come through these different pathways. We want to foster as many tentacles out into the community. So we say we want to increase the access, want everybody to really benefit from what we might have to offer.
I've got a question in the chat box. Do you cover other autoimmune illnesses like lupus?
Okay, so we don't at the moment. There's a few illnesses, correct me if I'm wrong, Rachel, that we do kind of specifically work with in terms of long-term conditions. And one of the reasons I'm here is because I'm aware that sickle cell isn't one of them. And that's kind of maybe something for me to be looking at, and maybe you can help me to kind of make the point within my organisation that is maybe it's one of the ones that we should be looking at, along with things like lupus, which, you know, I'm aware that these are things which particularly affect the sort of, you know, Africa, Caribbean communities, which is obviously something I have an awareness of. I myself carry the sickle cell trait. I've got family who have got lupus, so I understand these are problems which are quite prevalent, are more prevalent within our community, and it's ways of which, as part of my BAME lead role and our organisation's desire to kind of, and recognition that we're not maybe, you know, there's not as many percentage-wise of people from BAME backgrounds, and particularly Black Afro-Caribbean backgrounds in the community, considering the number of people there are in the community and who you would model they might be having mental health problems at any given time. They don't seem to be coming through our doors. So this is part of an attempt to kind of to reach out to you, to the community, and say, you know, what are the problems you're having? What help do you need? So in terms of, you know, things like sickle cell and lupus, we really want to support the local community.
Well, that's great, because we are underrepresented, you know.
Absolutely.
And what we do, like sickle cell, lupus, and multiple sclerosis, we usually network together. So, you know, so we'll find that a lot of people that are members of sickle cell cause do have like lupus, multiple sclerosis as well in our community that we work together with. So hopefully you will, you know, pick up on those illnesses as well. Does anybody else have any questions for our guys?
I would just like to add, whilst people come up with questions, with regard to what Ken said about long-term conditions, we don't specifically have a pathway for people with sickle cell. However, we wouldn't refuse anyone from the service if it's having an impact on their mood day to day. Obviously, kind of what would happen is they wouldn't be referred on to our long-term conditions pathway. So the reason why it's specifically certain conditions like diabetes and COPD is because we've had specific training to work with those conditions. However, kind of if your sickle cell is impacting how you're feeling day to day, then I'd still encourage you to refer, as we'll still kind of help with that. And one thing that we do kind of help with in long-term conditions pathways is chronic pain. So if you're experiencing chronic pain as a result of your physical health, then it could be something that we treat on the long-term conditions pathway. So that's something, because a lot of conditions lead to a lot of musculoskeletal pain and discomfort. So actually that's something that to think about as well, if that's relevant.
And just to, if I could, just to kind of polish, put the other side of that is, because we haven't kind of talked that much about it, is, you know, talked about kind of what sort of conditions or things might be suitable for us to kind of work with. The question is, if you've got any of those broad concerns I mentioned about, difficulties with, it could be sleep or mood or functioning, stress and worry, all those types of things, and living with a difficult health condition, by all means, I think I would highly recommend, and if it's affecting you, I would recommend making a referral for one of the pathways we mentioned. But once into the search, what it is, what do we do with you when you get you here? What do we offer? And in that respect, I suppose to let you know what we're really offering is things like what we call guided self-help, which is basically a CBT, cognitive behavioral therapy based therapeutic intervention approach, which involves kind of talking with a clinician on a week-to-week basis. It's like a week-to-week meeting with you, week-on-week meeting with a therapist. That typically lasts for about 30 minutes. Sometimes we do it online, sometimes we do it on telephone, and a lot of video work obviously going on at the moment. That's kind of like the first level. We have a step within our service. There's another kind of more intensive level of treatment, which is kind of the full-blown CBT, which is more likely to be somewhere between 6 and 12 sessions. Instead of 30 minutes, more likely to be about 50 minutes. More intensive work, and as somebody mentioned earlier, we also offer counselling within our service. Now that's kind of counselling within our service, which is typically about 6 to 10 sessions of 6 to 10 50-minute sessions of counselling each week. So that's kind of how we would, it's a typical mainstay of our offers. But we offer some online treatments as well. We offer some workshops. We do a thing quite similar to what you do here. We do an expert patient program, often with people who are struggling with long-term health conditions as well, where people get together as a group, because there's a lot of great knowledge and information in those groups about managing particular kind of conditions and difficulties. People can swap information, drop stories about kind of what helps each other, and they can share that kind of support. So that's kind of roughly what we do. It's not an extensive, and if what we do doesn't cover it, and if somebody needs something else, that's when we would say, okay, we've assessed you, we've found out what the problem is, this is what we offer. I don't think it fits with what we offer, isn't what's recommended for helping you, but what is recommended to help you is over there, and we will signpost the person to the next stage or the next level. So the person should always get what's most helpful to them.
Thank you so much for that. Thank you. Does anybody else have anything to add? Any questions or anything they would like to add? I don't know if you guys can see the screen. I'm sharing the screen, and it's got address and telephone numbers. Are those numbers correct for people to contact you, especially for those that are having issues accessing the link?
Mm-hmm. Only one thing I would just I'd like to ask your group before I go is, what are their thoughts? What might prevent them accessing kind of services like our own? Is it just that you don't know we're there, or some other reason?
Hello.
Hi, Faith.
Yeah, they say Faith.
Oh yeah. I think one is a couple of reasons. I think when I personally don't know, or the people that I work alongside don't know you exist.
Okay.
Two, when you go to the GP and you share your experiences and your difficulties and challenges, they're more likely to give you medication than a talking therapy.
Okay.
And then the third one is how do we then challenge the doctor to refer us onto pathways like yourselves? Oh, because I don't know the pathways. If I don't know you exist, I don't know the pathways. I don't know how to access the services. I don't know to ask the GP for your services.
Okay.
And sometimes the GPs are gatekeepers, and they don't refer you on to talking therapies.
So this absolutely. So this is why I just said, just kind of those very basic kind of criteria. I keep kind of coming back to. It doesn't need, we work with, people put kind of fancy names like, this is anxiety, depression, panic disorder. Really, if you're feeling yourself that you're something's changed. You realize you're not sleeping the way you used to. You're not you're not, wanting to go out or do things the way you used to, or just something really significantly changed. Your mood has really shifted. You'll know, your friends, or certainly your family will probably know. You can go to your doctors, but you don't have to wait for your doctor. You can always make a direct referral, and as long as you've made that referral, we will always assess you and take a look at whatever it is you're saying is the problem. We'll have a look, unless there's some other reason to make us think, oh, this isn't the right place straight away. But 9 out of 10 times we will call you in and try and find out what the problem is.
Thank you for raising the awareness. Thank you so much.
Okay, guys, I want to say thank you. Sorry, Rachel, did you want to add?
Just to ask, someone asked the final question, then I was asked, is CBT or cognitive behavioural therapy linked to specific conditions? I suppose Ken might be a good person to answer that in a bit more detail, but I suppose it is, but CBT is evidence-based to work with a wide range of what we call anxiety and depression disorders. But really, if people are experiencing anxiety, worry, stress, feeling a bit low, feeling lacking motivation, everyday things, often it is cognitive behavioural therapy, because it's a very practical therapy, is the evidence-based kind of recommended treatment. But again, kind of if you were referred to us, if you were coming into our service and we did do an initial assessment, which we always do, kind of a 30-minute initial call, we would explore what's going on for you and what the difficulty is, or what you might want to kind of work on during your time within our service. And then we would think about what we feel would be the best approach depending on what's shared. So it isn't for everything, but it is for a lot of things at the same time. So Ken, do you have anything to add to that?
Just in terms of what the person is, CBT, it's not linked to the conditions, but I mentioned before, this kind of nice guidelines. They look at each difficulty, each condition that somebody has, and then says, given that condition, what is the best treatment out there for that particular condition? And for conditions, the anxiety conditions and conditions related to low mood, what they say is the best, and by the best they mean the most effective treatment. They've compared all the treatments. The most effective treatment is a CBT-based treatment for anxiety disorders and low mood, and that's why we've been set up, because recognise that typical thing that people often struggle with. The best form of treatment appears to be, by all evidence and research, seems to be CBT. It's not the only one, and it's the best for certain people. Not everybody will benefit from it, because we are not all the same. So we also acknowledge that nobody's going to wants to force anything on it. For a lot of people, it seems to be the best, but for some people, it won't be as well. And that's why you've got to kind of take everybody as we find them, and find the thing that works for the individual.
Thank you. A couple more questions in the chat. Because of the pandemic, are your service currently over the phone?
Okay. So at the moment, yes, we're doing a lot of telephone work, but obviously trying to find, like yourself, different ways of doing things to kind of meet the needs of our client group. So yes, and a lot of phone. A lot of it was on the phone before, to be honest. We did a lot of telephone work, but we would also have been doing face-to-face therapies, which aren't possible right now. Okay. So those have either gone onto the phone, or we do them like this, kind of using kind of video platforms.
Okay, so people can have a consultation, a personal consultation, like via maybe not Zoom, like Microsoft Meetings or whatever the NHS use.
Yeah, I mean, the initial probably consultation or assessment will probably be over the telephone. Okay. Thereafter, if you are seen by this service, our service, and were to go into treatment, depending on what the treatment was, it's possible, if not likely, it would be using a video platform.
Thank you for that. And the next question is, how many sessions of CBT will you offer if accepted?
Okay, so normally it all starts off with an assessment. Okay, so we're always, the first session will be assessment. We kind of work out what the person might need. Okay. Now, and then what we do is kind of do it on a rolling basis. If you feel that CBT is acceptable or is warranted, we'll probably start off by saying, let's have 6 sessions. We'll see how it goes from there, see how we get on to. At 6 sessions, we'll review. If we think we'll need some more, we'll say at that 6 session, we'll add 3 more or 6 more. You know, if after that we'll review, if we feel we want some more, we can add 3 more or 6 more. So we've got some leeway. I would say typically it tends to be about in the region of 8 to 12 sessions. But by the same token, if you know we feel we needed 14, 16, 20, we could do that.
Brilliant, thank you. Oh, so I have to say, with that, I want to thank you both so very much for joining us, you know, today and sharing your information and your details so that we can get back to you. Somebody asked in the chat if this video would be available for participants. Yes, it will be shared to everybody that participated today and all of the Sickle Cell Cause members. You know, so the information will be shared, you know, during some point next week.
Okay. Can I just sort of say thank you again to you, Samantha, and to the rest of your group for letting myself and Rachel talk to you today.
Yeah, thank you so much.
Please, yeah, you know, I'd really, you know, whether people, I'll speak to Samantha about what might be useful, and maybe you can speak to her about what you would want to do. We might be able to set up individual workshops for your group, or if you want to come and access our service, you're more than welcome. And even neither of those, it'd be really nice just to stay in contact, because I think you're a really valuable source of really talking to our service about what are the needs of some of the Black community in our area. So please keep contact. It's been a pleasure speaking to you today.
Yeah, if you've got some up-to-date literature as well, if you can email it to, you know, to us, Sickle Cell Cause, and then we will share it, you know, with everybody so that they have more concise information.
Okay.
I can do that, yeah.
Okay. Thanks very much again, and have a great meeting.
Okay, thank you guys. Thank you so much. Thank you.
Bye-bye.
Okay. All right, moving on, guys. Next, we have not so much a guest speaker, an in-house speaker, our group's chair. She was only supposed to step in for a year, you know, until we managed to get another chair, until we elected another chair, and then she was elected again the following year because of her brilliance, you know, and then the pandemic hit, so she's still our chair and she's still doing a wonderful job, especially in our family welfare department. Leanne also has a professional packing service, and she is a Kemetic Yoga Basu, and she does many courses throughout the weeks. I'm sure she even had one, had one this week. I mean, sorry, today, this morning, before we started here. Don't know why I'm going backwards with my presentation, but I'd like to introduce you now to Leanne Palmer, otherwise known as Basu Lee in the community, our Kemetic Yoga instructor, who's going to explain to us the benefits of Kemetic Yoga, what it is and its benefits. Are you there, Lee?
I am. Can you hear me?
Yes, I can.
Can you see me?
No. What can you see on your screen at the moment?
I can see Kemetic Yoga flyers.
Oh, brilliant. So what I'm going to do is stop sharing so you can share your screen. There you go.
Okay. Okay, greetings everybody.
Greetings, Payne.
Greetings. Thank you for your time and your presence here today. And thank you to Ken and Rachel for that information that you've just shared. It's important that we know what's available to us in the community. So that was positive. Can you see me?
Yes.
I can't see myself, so I don't even know what I look like.
You look okay.
Good. Oh, well.
Fine.
Okay, so today we're going to be talking about Kemetic Yoga. Kemetic yoga is quite a broad subject. So I have, what I'm going to do, I'm going to speak generally about yoga and apply that to the sickle cell warrior. And then towards the end, I will pull it in the context of, Kemet, of it being Kemetic, just so that we're a bit more concise. So, I'm putting it in the context of exercise, because I think when I've spoken to people, generally when you talk about yoga, it's a form of exercise. So it's a well-known fact that physical exercise and endurance training are the most constructive ways to boost muscle, improve skeletal muscle, increase oxygen supply, and to gain overall physiological benefits. However, sickle cell warriors face a unique dilemma, and that is because of the potential of spiraling into crisis if undergoing or participating in strenuous activities. So I'm sure most warriors would agree with that. From my experience and the work that I've done with warriors, that's the feedback that I've gained. So historically, exercise has been considered too risky for sickle cell warriors, and that is partially due to the notion that heavy exercise can lead to increased heart risk and, as I've mentioned, sickle cell crisis. So high intensity or extreme exercise can lead to increased inflammation, oxidative stress, metabolic acidosis, and if I can pronounce this word properly, and I'm not even going to try it, but you can see it on the screen there. So, and a common thing that does happen is exercise collapse, and that is usually as a result of physical exertion, extreme heat, dehydration, and sometimes genetic predisposition. So we're really looking at low intensity exercise, and although
I think you've frozen, Leo.
of the body through the postures, and those postures could be done as individual postures or as a flow of poses. So what are the benefits? Yoga has a multitude of physical benefits, and if we're just kind of looking at the warrior, some of what the warrior kind of has to deal with, I would say it's beneficial in reducing stress, improves blood circulation, and it promotes relaxation. It improves flexibility, strengthens the body, and helps tone muscles. So since yoga is a low impact practice, it falls under the category of light, moderate intensity exercise and can be further tailored to suit individual warrior needs. So that aids in further lessening the risk of crisis due to strain or overexertion. So regular sessions of yoga can bring great benefits to individuals' lives and considerably improve physical well-being and the quality of life, which we've mentioned already. So there's a list there. So like I said, there's a multitude of benefits. So I'll just share a few that are on that list. It helps flexibility of the spine, and flexibility is very important because flexibility can literally determine your lifespan. So it's very important that we're doing things with our body that's going to aid its flexibility. It relieves fatigue, it aligns the skeletal system, improves overall body strength. So if you look at that list, you'll see there's things there that are pertaining to the physical body, the emotional health, and as well as the spiritual. Because if you see at the bottom, it leads you to a place within yourself that is peaceful, harmonious, and balanced. as in accordance with existence and nature itself. So yoga does have a very deep undertone. It's not just about physical exercise, but the physicality of it is very beneficial to all of us, but particularly for a sickle cell warrior, as it being a low intensity form of exercise, it's something that can definitely be of great benefit. So just to touch on a little bit of research, like I mentioned before, there is a lack of formal and duteous research on the subject of exercise and how it really affects sickle cell warriors. But like I said, there are some emerging case studies coming up. And in 2019, researchers studied 32 participants for 8 weeks as they engaged in 40-minute sessions of moderate intensity exercise. And they found that a significant improvement of blood oxygen delivery to tissues and overall physical health. So this recent development in research highlights the imminent need to redress how sickle cell patients and healthcare practitioners view exercise, and to find a sustainable dosage of exercise that optimizes the balance between health risks and long-term benefits. So it also opens up the possibility of using exercise to address pain management as a strategy to prevent commonly arising multiple conditions. So we know that with sickle cell warriors, it's not just the sickle cell, there's always some other complicating factor that is combined. So that's how we're looking at yoga as a way to reduce some of these additional health concerns or issues. Another one here. So according to a survey conducted by the research group in 2017, 90% and 48% of children with sickle cell disease participated in physical activity and sports, respectively. The study concluded that children with lower participation in physical activity reported a greater impact of their condition. So the sickle cell crisis is one of the most common complications among children, and the primary cause of acute pain in pediatrics. So in 2017, another study was conducted to examine the impact of regular yoga sessions on children aged 5 to 21. The hospitalized children were offered daily sessions of meditation, yoga poses, breathing techniques, and guided relaxation. The objective was to measure the efficacy of the yoga in pain management and to check if it could replace their reliance on medications, pain relief. Many participants reported a substantial reduction in mean pain score right after the first session. So the study later concluded that yoga is a helpful, acceptable, and feasible non-pharmaceutical intervention for pain management in children. So children who undertake moderate intensity exercise can combine it with dietary supplements that will reduce inflammation and increase blood flow. This can help manage muscle cramps and improve blood circulation to ensure smooth progress. And then it's going into dietary stuff there, which we're not really focusing on today. But in conclusion, cultivating a daily regime of a friendly yoga routine can be beneficial in improving physical ability, muscle function, and blood circulation. Moreover, it may result in better sleep, social interactions, and stress reduction. So you can combine exercise with, a good healthy diet. And just to touch on as well, what they found from their report is that breathing techniques, they're focusing on pranayama here, but deep relaxation techniques and breathing techniques like guided meditation and moderate yoga can be an effective long-term solution to relieve reoccurring and chronic pain. So let me just check something because I feel like, okay, I forgot I missed something. So really what we're saying here is that yoga offers a simple offers simple self-care tools such as meditation and deep breathing exercises as a resource to help reduce pain. And these are accessible, they're easily modified practices that can be performed by anyone living with the sickle cell condition. So what I want to do, so that is really, you know, a bit about yoga and how it can benefit sickle cell warriors, as well as, you know, any person. But Kemetic Yoga is a contextual, just bear with me 1 moment. Yeah, it is contextual, and essentially it is a way of life, and it's a way of life embedded in ancient. It's a way of life embedded in the culture and philosophy of ancient Egypt. So many of you may be familiar that ancient Egypt is, may know it as Kemet, which is the land of the blacks, or you may know it as Merita, which is the beloved land. So just to kind of keep it brief, if you see some of these images on the screen, these are actually postures taken from temple walls across Egypt. And these are our earliest inscribed evidence of yoga. So when we're talking about philosophy and culture, we kind of have to put that into context, because when we're talking about philosophy, we're actually talking about the study of the fundamental nature of knowledge, reality and existence that acts as a guiding principle of behavior. And then when we're talking about culture, it's about that, it's an integrated pattern of human knowledge and behavior. So that involves language, that involves the outlook, the attitudes, values, morals, goals, and customs shared by a society or a group of people. So yoga is embedded in values, culture, a way of life, principles, and it is actually the principles of ancient Kemet. And so what we come to learn now is that all the other yogas that we're familiar with, even that word yoga, that's what I was saying, the word yoga is not a Kemetic, it's not a Kemetic word. So you wouldn't go back to the temples and see the word yoga, you would see other words. It's like these symbols here in the middle, the Ankh, which is a symbol for life. And you see there, you got Uja in the middle, which means prosperity, and then the Senab. This is Kemetic language, which is actually what the West or Europeans will refer to as hieroglyphs. Is actually, the language is actually Medu. The Medu that you find on temples is Medu Neta, which is what they would call the language of the gods. It's a tiered language, so the everyday people in those times would have spoke Medu Mait. And so it's a big area. We learned that language is actually the cornerstone of any civilization. And what we see with the Kemetic language is that it actually represents nature. It's reflective of nature. So I'm probably going off into so many different directions, so my brain's kind of going a bit wild at the moment. But the important point here is that yoga is not just a physical exercise. It's a culture. It's a way of life. It's embedded in principle, and those principles go back to our history as African people. And all the other yogas that we see, such as the Hatha yogas and asana and all those things, they're derivatives of the original. So there are a multitude of benefits in learning the real meaning behind the postures, because every posture actually comes with a concept. So in ancient Kemet, the idea there was that everything came out of a oneness. So, but we have gods and goddesses, which we refer to as the Neteru, and they are aspects of the oneness, or that one source creator, that one God. They're all different aspects. And these postures actually represent, they personify the energy, the entity, the persona, the characteristics of these aspects, different aspects of the one divine. So they come, so if I give you an example, if you can see this, I don't know if you can see the arrow, but this posture at the bottom here, Ma'at. Many people may be familiar with Ma'at, and Ma'at represents balance, justice, righteousness, all of that kind of stuff. So when you're actually going into that posture, you're not just thinking about having a toned stomach or, you know, strengthening the arms. You're actually consciously using the breath to guide the movement and to consciously emulate or resemble the essence of that persona. So that is very brief. That's a very brief kind of insight into what Kemetic Yoga is. I do run a 4-week series program that goes a lot deeper into what Kemetic Yoga is, the postures, the meanings behind them. So it's partially theoretical, and then we do the practical. So if you're interested in that, you can get in touch with me. You can email me, I'll give you my email address at the end. And we also touch on the language and its relevance in the practice in that program. And yeah, so if there's any questions, I can do my best to answer any questions, but my email is there, info@ebonycar.com. And we do have, we do a yoga session on the 4th Saturday of every month, and that is really tailoring to suit sickle cell warriors. So it focuses more on the breath work, on the meditation and relaxation. We do incorporate postures, but not strenuous. So they're very light postures. So for anyone that is a warrior and you want to try it out, we're doing that every 4th Saturday of the month at 11 o'clock. And I do have another session that I run on a Wednesday at 11 via Zoom. It's a divine feminine, so we incorporate a lot of the postures that reflect the divine feminine, but it is donation based, and those donations go to sickle cell cause. So yeah, it will be good for you to support that particular session as well. But for those that want to really know more, get a lot more in-depth understanding of Kemetic Yoga, the 4-week series program is what I would advise. So yeah, if there's any questions, I can take them now.
I'm just looking in the chat box to see if anybody's got sounds powerful healing course. Sister Patricia says. Got comments, but no questions. So if anybody wants to ask anything openly, now's your chance. I'd like to ask, I know that a couple of sickle cell warriors have contacted you, you know, through Sickle Cell Cause for children. How are those courses going?
You just reminded me of that. So yeah, so yeah, I do a Saturday morning session at 10 o'clock. The first part, the first 15 minutes is for sickle cell warrior children. So all children are welcome. Pre-teens, at the moment, is predominantly female, but males are more than welcome. So there's like the first 15 minutes is really just for the warriors. So the warriors come on first, and we'll go through a few breathing exercises to kind of, and you know, discussion about sickle cell and how they're managing with that. And then at 10:15, the other young people can tune in, and then we do a yoga session. So that's every Saturday morning at 10 o'clock. So yeah, if you want information on that, or you want to get your children involved in that, you can email me, and I can forward you the link for that. And it's going very well, actually.
Brilliant.
Yeah, it's going very well.
I'm pleased with that because I was the one that got the initial calls that forwarded it onto you. So I'm happy with that. I've got somebody asking, is this for males? I'm assuming that he's asking about the courses, the full courses and everything, you know, because
Yeah.
he already said the feminine divine, a male's welcome.
Yeah, so the divine feminine is for women. On the Wednesday morning, divine feminine is for women. But yeah, everything else is, you know, masculine and feminine energy is welcome.
Okay. Got a comment that Mr. Phil loved the history lesson on the origins of Kemetic Yoga. You know, I hope to see you on the next course, Mr. Phil. We learned so much on the actual course, you know. So you spoke up, so now you raised
Yes.
it. Okay.
Yeah,
so,
I have to apologize. I feel like it was a bit, you know, all over the place just then, but yeah, come onto the program if you're interested and you really want to know more. The program is where I can really delve in.
Brilliant. I think Faith wants to ask something. Sister Faith?
No, I haven't got a question. Yeah, sorry, I'm talking over you. I'm so sorry. I haven't got a question. I'd just like to thank you for the presentation. It wasn't all over the place for me. It's really interesting, and it's something that I wanted to do for a while. So I've been led to this path. So thank you.
Well, thank you
for your presentation.
Thank you very much. My
And
pleasure.
I'm from Cardiff in Wales, so via Zoom, hopefully we can link up and link some of the children, Sickle Cell Warriors, to this Saturday session as well. So thank you so much. Thank you so much, Samantha, for the link. It's been really beneficial. So thank you so much.
Yeah, I'll make sure that the links are shared for sure. Leanne, can you please share where you've done your training, just so that everybody knows that you're trained, and you know, just give a little.
Okay, yeah. So I certified in level 1 with my instructor. His name is Basu Neta Ankh Aku. He's got over 20 years experience of Kemetic Yoga, and himself was trained by 2 renowned Kemetic Yoga. I don't want to call them instructors because it's a lot deeper than just being an instructor. One of them is actually a scholar, which is Mauta Ashby, and then a renowned Kemetic Yoga. They call him the king of Kemetic Yoga, which is Ra Hetep. And where I am certified, I went to Portland, Jamaica, and I was initiated into the Nanny Maroon Falls. So it was a phenomenal experience. I have to be honest. When I went on that program, I thought I was going on a retreat, and I had never actually sat a class of yoga in my life. So I went, and it was an experience that completely changed my life, to be fair. So yeah, that's where I certified, and it was very powerful because the most powerful part for me was going to Nanny Falls and being initiated there and communing with the Maroons of that area and observing them actually holding on to tradition of how many millennia years ago. So it's so strengthening to see that we have fought to retain, to hold our sacred culture and our traditions, and it's very much alive. And that's why language is so important, because when we say ancient, it sounds like referring to something that's dead, that's no longer functionable, and it is very much functionable. There are many tribes in pockets of West Africa, and even, you know, some of the Maroons in Jamaica, that they've retained this culture to some degree, some to a lesser degree, but it's there. So that's where I certified. I'm also certified in level 2, which was done online. And that really delved a lot more into the philosophy side of it and the theory side of it. So it was very much studying. It was a lot more mental, whereas level 1 was more of a physical experience. And they're both very profound.
Thank you. I know you said that you'd never sat a yoga class. I know you meant you'd never sat a Kemetic yoga class, because we did have
no
in our group by Sister Anna, you know, who used to come and do yoga. So it wasn't
yes, that's right.
I knew what yeah.
I did yoga with Anna
In the Gambia even.
After. I'm trying to think.
And I'll just see if there's any questions in the chat.
Yeah, I need to, okay, sorry.
Approximately how much does your course cost? I'm assuming they mean the 4-week course.
Yeah, it is. I need to get I need to share the flyer a bit more widely actually. So it is £120, but there is an early bird price for 80 for those. So the next program is mid-March. I think it's the 17th of March. Starting the 17th of March. So for the early bird, for £80 that would need to be paid before the end of February.
So how can
otherwise it's 120.
So what's the best way for people to get that early bird? Just to email you at info@Ebonycar?
Yeah.
Okay.
I do have a website. It's just not live at this present moment. The website is ebonycar.com, and I am on Instagram also as Ebony Car Essentials.
Okay, thank you.
But the email is the best form of contact for me right now.
Fantastic. And is there anybody else with any questions of any form? With that, I'd like to say to you, Leanne, thank you so much. I personally enjoy the sessions, you know, and I just want to thank you for the work that you do, you know, with other sickle cell warriors, the children. You do phenomenal work, and it's not just with the yoga, with everything you do, you know, so appreciated. You know, love you so much. Thank you very much.
Thank you.
Okay.
I love you too. Thank you very much.
Okay, so if you don't stop sharing, then we can see who's on the screen, so we can say our goodbyes to everybody and end our meeting for this month. Thanks. I'm not sure if everybody can see everybody on the screen. I'll put my... Okay, that's brilliant. Oh, that's better. I had it on speaker view. Okay, everybody, thank you so much for joining the Sickle Cell Cause for our February 2021 edition of Open House. It's been a real pleasure. Thank you to our guest speakers and our in-house speaker. Please email sicklecellcause@gmail.com if you want any more information about today's event or anything to do with Sickle Cell Cause. And all I can say is, like, wishing you a great month ahead, and see you next month on the 3rd Saturday of the month. Peace and love to everybody. Thank you. Take care.
Peace and love.
Thank you. Blessings.